Hello, everyone. We are talking about jaundice in babies today. Now, most people have heard of jaundice, but what actually is it? What are the causes and what needs to be done? I am joined by the fabulous paediatrician, Dr. Deb Levy, today, who's going to be answering all of your questions on jaundice. My name is Sarah Hunstead. I am a paediatric nurse, mum of two, and founder of CPI Kids. And Deb, now, we're talking about jaundice today. This is a subject as an emergency nurse that I certainly don't know a lot about. So I'm really looking forward to learning from you today. And, when we first talk about jaundice, often we think about, big lights and babies with yellow skin. But I'd like to go back to the beginning on that. And that is, can you tell us, first of all, what actually is jaundice? And for those of you who are joining us, please don't forget to post your questions in the comments below for Deb, because she would love to answer them while we are live at the moment. And of course, tag anybody that you would like to know this good evidence-based information. So Deb, thank you. Tell me, what is jaundice?
There's a short answer and there's a long answer. And for those of you who know me, know that I usually err on the long side. So look, I will start with a short answer, and you've kind of given it away already in saying that it's the yellow discoloration that a lot of babies get. So around about 50 to 60% of healthy newborn babies will have a period of jaundice.
Wow.
And yeah, exactly. It's massive. I know one, if not two, of my babies had mild jaundice, and I'll go into all of this in a little bit. And the good news is in that the vast majority of children, it's totally benign and it just passes without any need for intervention. So I guess back onto, what is jaundice, recognizing it in a baby. It starts off in their eyes, where the white part of their eyes, which is called the sclera, becomes yellow. That's usually the first sign, and then it kind of spreads. And it's very, I find this quite fascinating in the human body, that it starts in the eyes and it goes through the face, the body, and then out to the arms. So you can almost tell how severe it is just by where it is on the body. And there are even graphs of that, diagrams, sorry. But typically speaking, in this modern day and age, we do have better ways of actually determining how high the levels are of jaundice. And that's either through a transcutaneous probe, which is really just a fancy word for a little probe that sits on your child's skin, doesn't hurt, and takes a reading, or a blood test. And that's typically through a heel prick test, where they prick your baby's heel, squeeze a few drops of blood into a tube, and test it that way. So that is what jaundice is. And I guess the next question is, well, how does it happen? And why do so many babies get it?
What causes it?
Yeah. So jaundice, the more medical definition, I guess, is an elevated bilirubin. And what's bilirubin? It's a waste product of your red blood cells. So your red blood cells, I don't think there's any other way for me to describe what a red blood cell is, other than to say that babies have a lot of them. And often you'll find, babies are born and they look quite what we call plethoric. In other words, they're quite red. And, babies just often will have a lot of red blood cells circulating, a little bit more than normal. And those start to break down, which is entirely normal, by the way. All of our cells are always breaking down and being replaced. And the difference in babies is, though, one, they often have a little bit high percentage of them. And then two, their livers haven't matured yet. So why does that matter? Well, one of the liver's jobs is to take that bilirubin and excrete it as a waste product. So until such a time that everything is effectively working, which usually takes a few days for things to kick off, that is often when jaundice will occur. And that's what we call, by the way, physiological jaundice, which is that normal, benign jaundice that the majority of babies will get.
Yep. And are some babies more at risk than others of developing jaundice?
Yes. So the babies more at risk are preterm babies, so less than 38 weeks gestation, or babies that are exclusively breastfed. And let me just explain that one a little bit. So one of the reasons why babies can get jaundice is if they're a little bit dehydrated. And typically, exclusively breastfed babies, and those of us who've been through the process know that it takes a few days for milk to come in, your milk as a mum to come in. And that means that for the first few days, your baby often isn't getting, the volume that they necessarily need to help them flush this bilirubin out of their system. So, and that fits in, if you look at the typical pattern of this physiological jaundice, where it usually starts on about day 2 or 3 of life. And then it'll peak at about day 4 or 5, and then it goes. So that's kind of your pattern, which is in keeping with when mum's milk comes in, which is usually, and I'm not a lactation consultant, but it's usually about that day 3 or 4.
Okay, excellent. So just say you notice that your child perhaps does have that, yellow discoloration to their eyes. Are there any other signs and symptoms that you might notice? And, how do you know if you need to see a doctor?
Yeah. I think I'm going to divide this answer into 2 categories here. And one I'm going to say is around, well, when should you worry? And when is jaundice more likely to be a problem in terms of something more than just that physiological jaundice? And there are a few alerts that we always have. And one being, and when I talk about alerts, I mean like a red flag. And one of them being jaundice within the first 24 hours of life. So although I've been describing the typical cause of jaundice, there are medical or like disease causes. And those are things like if there are problems with your baby's red blood cells, or if you've got blood incompatibility, like most mums have heard of things called rhesus incompatibility, but you can also get blood group incompatibility, or even if their liver is actually got a congenital problem, which in other words is a liver disease that they're born with. So in babies who have those more medical conditions, the first clue is often that early onset, and then the severity of the jaundice as well. And the severity is, clinically looking at them, the blood levels, and your baby's blood level will be plotted on a graph, which is the level compared to their age. And that determines what treatment they need, if any. And then the other things that we look for are, and I'm pausing because there's just something I want to talk about that I don't want to forget. The other thing that we look for is, what color are their wheeze and poos? And that can give us a clue whether there's underlying liver disease. So these are all questions that your physician should be asking and be looking for. So my message is if you think your baby's jaundice, just get them seen. It's not something that you should be pondering, or certainly not looking at Google for.
Yeah, good. That's an important thing, a very important thing. So if your child actually does have jaundice, what kind of treatment is out there? I mean, certainly you see what's on the movies, and most of us know about lights and things like that. But what is the actual treatment?
Well, yes, lights. Firstly, the majority of children don't actually need anything, and it often just goes away. Sometimes maybe they'll have a few what we call supplementary feeds or complementary feeds when they're given either some express breast milk, or that mum's stored while she was pregnant, or, the colostrum or formula, whatever it may be, just to boost that hydration to help them wash it out, or it's just monitored. And that's by far the majority. And then if it's high enough, your baby will need lights. That's called phototherapy. And what that does is that through the skin actually helps with that breakdown of that bilirubin. And there are different ways that your baby may get this. Sunlight isn't enough, unfortunately. But they can either be put on something called a billy bed, which is like a bassinet, those wheelie bassinets that newborn babies are usually put in hospital, except instead of it being a mattress, it's actually like a bed of lights. It's almost like those old-fashioned sun tanning beds. So exactly, and then they get zipped into that. It's really kind of cute because they're all like glowing like this little like a little bug in a cocoon, so it looks kind of sweet. Or they may need what's called the overhead ones, where they actually are in the neonatal intensive care unit or the special care nursery release. Not they won't need intensive care, and then they usually strip down, bare buck naked with little sunglasses on, which are often just like little little material ones that they strap around, and they put underneath that for whatever period is necessary, depending on their level and how they're responding.
Yep. Are there any side effects to the phototherapy at all?
Babies can get rashes, and they can get a bit dehydrated. So often they'll need those supplementary feeds that I've mentioned. And they can also get diarrhea. So it's quite common for babies to get funny poos from phototherapy.
Okay, that's actually really interesting. Just one more question as well. And remember, anybody, if you've got any questions about this, now's the time to pop them in the comments below. Although, Deb, I must say, you have answered everything so beautifully here. I'll be surprised if you've got any questions, because you've been so thorough as usual. But for babies with jaundice, are there any long-term complications, or is it just have a bit of phototherapy and then all good?
Yeah, look, 99.9% of the time it is that. Look, I think it depends. It depends on, and I hate that answer, it depends. So I try and avoid it, but I just did it. But it does. It depends on why your baby's jaundice, So you're talking a physiological jaundice, no, unless the levels go extremely high and it's not recognized. And then, if the levels are very, very high and it's not treated, not recognized, then your baby can get something called kernicterus, which is when it can actually impact their brain. But it is so rare. I don't want parents to worry about that. If they're under the care of, a physician who's looking after the jaundice, honestly, it's really, really rare. The other things that, sorry, I'm pausing because I realized I didn't tell you what I wanted to talk about earlier. So really it's about the cause. So, for example, if it's a liver problem, yes, there's going to be consequences from that, and that needs treatment. And, the classic thing that some children will get when they get that early jaundice with liver problems is something called biliary atresia, which is a significant medical problem. But again, this is not a common condition. The other thing I also wanted to mention is, other causes, and this is more not for early onset jaundice, but if the jaundice is just lingering. So what we call is prolonged jaundice. And that's, the definition is usually beyond a 2-week period. So if baby still has jaundice beyond 2 weeks, we always have to think why. And I'm a big fan of always looking at the whys. And the things we need to exclude are underlying infections. Your baby could have a UTI that's been missed. They certainly can't complain, of problems. They could have thyroid problems that have been missed, although it is screened for on the newborn heel prick test. It is something that should be chased up. Or it could be, again, blood disorders, liver problems, and that just haven't been picked up yet. And the other thing to mention is prolonged jaundice can actually also be normal. But the normal, and this is normal in exclusively breastfed babies. The point that I want to make, and the reason I mentioned it last, is that that prolonged breast milk jaundice in my books is a diagnosis of exclusion. So in other words, I will always exclude the medical problems before I go around saying, yeah, it's just from breast milk jaundice.
Okay, got it. Fantastic. Well, Deb, I don't know about everybody else out there, but I feel like I know a whole lot more now. So thank you so much for sharing your extensive knowledge. We will be back again the same time next week. So that is 10 a.m. Sydney time. So next Tuesday. I'm not going to say Wednesday again, although I keep wanting to say Wednesday. I'm not going to do that. And remember, please DM us with any topics you would like us to be talking about now. And also go jump on Dr. Deb's Instagram, because she has got some absolutely fantastic resources there for you, and a lot on the newborn topics as well as, of course, everything else. But we've been talking about the baby stuff today, so there's a whole lot more stuff there. Thank you so much for joining us, everyone, and we will see you again next week. Okay, bye, everyone.
Thanks, everyone.